Okay, today's topic is scrotal lumps, which is an important exam for surgery, clinical exam as well as in theory. Okay, these are the various anatomical aspects of the testes and the scrotum. Here you have got the main thing here, okay? Spermatic cord, the testes which has descended from the abdomen and descended into the scrotum. It is followed by the uh, covering known as the tunica vaginalis, 2 layers of the tunica vaginalis which is covering the testes. This is the testis, and then it is drained, is accompanied by the not the spermatic cord, which is accompanied by the testicular artery and a venous plexus known as the pampiniform plexus. Okay, so you have, and then the vas deferens here, cremasteric muscle, tunica vaginalis, testis, then the dartos muscle here, skin and the dartos muscle, and this is the epididymis. This is the testis, this is the epididymis, which becomes the joints to form the spermatic duct, vas deferens, and this is the pampiniform plexus. Okay, this is a detailed anatomy of the testis. These are the covering the tunica vaginalis and the tunica albuginea. Then you got your seminiferous tubule here, and then there is all drain into a small plexus of ductules here, which is known as the reti testis, and this is the which unite to form the epididymis. This is the head of the epididymis, body and tail. Then this is the epididymis of vas deferens. Okay, and here is the really 2 layers of the covering of the testis. Okay, the tunica vaginalis got a visceral layer and a parietal layer, and there's a potential space in between the 2 layers. Okay, here the testes form the reti testis, then they form the epididymis, we join to form the epididymis head, body and tail. And here is the venous drainage of the testes, which will be important, which I'll tell you later. The right side is drained, the testicular vein is drained into the IVC directly, and on the left side, the testicular vein ascends upwards to the left renal vein, where it joins the left renal vein at a right angle. Okay, and this is important in the development or genesis of varicocele. Okay, here again. Now, what is a scrotal lump? The scrotal lump is an abnormal mass or swelling within the scrotum. It can originate from the testis or extra-testicular sources. Okay, can be two origin, testicular origin or extra-testicular origin. Okay, as shown in this diagram here. This is the spermatic cord. This is the epididymis, the yellow in color, and then here tunica vaginalis, inner layer and outer layer. Okay, visceral and uh, parietal layers. Okay, now what are the differential diagnoses? What are the possible causes of these testicular lumps? Okay, scrotal lumps may be classified either, as I told you, testicular origins such as orchitis, torsion, and tumor, benign or malignant testicular tumors, or it can be of extra testicular origin, that means outside the testes. And this is the commonly encountered conditions are epididymal cyst, epididymitis, varicocele, and hydrocele. And usually epididymitis is due to either viral or bacterial infection. It usually occurs together with inflammation together, both of them, that is known as the epididymal orchitis. So here you got the epididymal cyst here, got the orchitis, swelling of the testes, hydrocele, fluid covering the testes, within the fluid accumulating within the layers of the tunica vaginalis. Then it can be cancer, origin from the cancer, and orchitis originate from the testes, epididymitis, varicocele, hydrocele. So these are some of the conditions that you will encounter in the patients. Now, what are the clinical features of scrotal lumps? First of all, it's very important to get a quite good history. your time of onset, associated symptoms, especially the pain. Pain is one of the most important symptoms, and whether there's past history of similar pains. In most cases, however, the diagnosis of a scrotal lump can largely be made from clinical examination alone. So on inspection, you look for the 6S, size, shape, symmetry, skin changes, any scars present. Palpation, 3Ts, tenderness, temperature, and transillumination. So these are the three important T's and 3Ts. And the other things are known as the campfire. This follows the code: consistency, attachment, mobility, pulsation, fluctuation, irreducibility, and regional lymph nodes, and also the age of the lump itself. The nature of the age. Then you must be very careful. This lump must be very carefully examined, specific to the scrotum, and is identify the various parts of the scrotal mass lesions separately from each other. So you must make sure it is identified, its relationship to the testes, the epididymis, and the vas deferens. And for the investigations, for the majority of scrotal lumps, especially those testicular in origin, it's very important to do a basic test. And the basic or important test involves the ultrasound scan of the scrotum. Is one of the first line investigations in most cases. Blood tests, especially the hormone markers, alpha fetoprotein, beta HCG, and lactic dehydrogenase. These are the three markers that you have to do for patients with all lumps, cases of scrotal lumps. And then subsequently, you may want to proceed on to do, if the ultrasound does not give you much information, you may want to do a CT scan. And it is especially used not for diagnosis, but for staging of testicular tumors. So this is a summary investigating a suspected testicular cancer. Important thing is your biopsy is usually not warranted because it can, due to the risk of seeding the cancer in the scrotum. Instead, it's purely made on clinical features, and especially, or if necessary, you go for a orchidectomy and biopsy. The other thing is blood markers could be done, blood tests. As I said, lactic dehydrogenase, alpha fetoprotein, and beta HCG, gonadotrophin. Now what are they? I'll go briefly through some of the extra testicular origins of the sum of conditions. One of the most common one is called hydrocele. Hydrocele is an abnormal collection of peritoneal fluid between the parietal and visceral layers of the tunica vaginalis, which envelops the testes. It is usually presents as a painless, very important, painless fluctuant swelling because its fluid is fluctuant, and that will transilluminate. And this transillumination test is a very important test to diagnose hydrocele, and it's especially important in children, which I'll show you some pictures. It can be either unilateral or bilateral, but usually is unilateral. Occasionally, it can grow to very large size and cause severe discomfort that may compromise the patient's walking, and these cases may have to go for surgery. There are two main types: congenital and especially in children and infants, congenital hydroceles. It accounts for about 3% of male children. It's due to the patent processus vaginalis. It regresses spontaneously by the age of around 2 years. Usually they don't need any treatment, just observation. Unless it becomes bigger, then you may go for surgery. In older patients, hydroceles may be primary or secondary. Primary means idiopathic, you don't know what's the cause, whereas secondary is usually due to three main causes: trauma, infection, and malignancy. These are the three secondary causes of in adult patients of hydrocele. Those patients presenting those presenting with a hydrocele between 20 to 40 years, or where the testis cannot be palpated, should undergo urgent ultrasound scan. Okay, it's very important when you palpate the testis, you must be able to the scrotum. You must be able to feel the testis apart from the hydrocele. But if the hydrocele is big, then you may not be able to feel the testis. So you may want to do a scan, ultrasound scan. It is important to note that hydrocele can form along the spermatic cord, and it's a differential for the lumps in the groin. Okay, that means the hydrocele can extend into the spermatic cord, and this will present as a groin lump or a hernia. Okay, this is the transillumination test. Involves the use of a pen torch to shine light from behind the scrotal lump to observe whether the light travels through and illuminate the lesion like this. You put a light here, then you light in a dark room, then you see now the light is going, illuminates the scrotal wall. Okay, here again, it's in children very easily seen. Okay, this technique just shows you that the scrotum here is filled with fluid. Okay, and most of the hydroceles and epidermal cysts, large epidermal cysts, will be transilluminant positive, and this is especially so in children and infants. Okay, this is the ultrasound scan of a patient with hydrocele. This is the fluid filled testis here. Okay, and this is the testis. Sorry, fluid filled scrotal space, tunica vaginalis, and the testis looks like it's floating within it. Okay, the next one is varicocele. Varicocele is abnormal dilatation of the pampiniform plexus, venous plexus, which is, as I showed you just now, it lies along the vas deferens, spermatic cord. They present as a lump, often described as a bag of worms. Actually, they are all dilated veins, like varicose veins within the bag called the scrotum. So when you examine him, you will feel it. The scrotum will be, you feel the scrotum as containing a bag of worms. And they can have a dragging sensation, dull, aching, and dragging sensation. And in some instances, when they are smaller, when the patient lies down, the lump can disappear. Okay, or become smaller, reducible. Okay, and then you can make it come on again by ask the patient to strain or stand up. Okay, then the veins become more prominent, similar to varicose veins of the leg. 90% of varicoceles are on the left side, which I told you just now, because of the venous drainage. Okay, on the right side, it drains very freely into the IVC, whereas on the left side, it goes at a perpendicular angle here, 90 degrees at the left renal vein. So there's some, if there's some slowdown of some form of obstruction here, then it causes varicocele. So 90% on them occur on the left side, because the spermatic vein drains directly into the left renal vein. The other important thing is about varicocele, it's a cause of infertility and testicular atrophy. When these veins are big, there's a lot of blood engorgement, and this causes increase in temperature for the testis. Okay, so the testis under higher temperature undergoes atrophy and leads to infertility. So in this patient, you may have to do a semen analysis to assess the functions of the testis. Okay, now there's a very important thing I'm telling you on the left side, because red flag signs of a varicocele are those of occur on the right side. If it occurs on the right side, then you must think of some form of blockage of the IVC, like a IVC thrombosis. Okay, asymptomatic varicoceles, many of them are asymptomatic when they're small, with no alarming features, and they do not really need any active treatment. Surgical treatment, if they are big or if their patient is semen analysis of the testis is atrophy, then you may want to embolize these veins, these testicular veins, pampiniform flexus. Okay, embolization or ligation of the spermatic vein. The spermatic vein or left testicular vein here, you ligate them and this will obliterate. Okay, this is an ultrasound. Okay, this is the structure. See the pampiniform flexus become very engorged due to blockage of the vein higher up. As a result, this bag of worms feeling. Okay, ultrasound shows you here normal ultrasound, dilated veins here, and you do a Doppler. This is a Doppler, so it shows you the veins, colored blood vessels that are dilated.
Okay, the third structure, the third condition that arises from the extra testicular origin is epidermal cyst. Okay, this what epidermal cyst? The epidermal cyst, also known as spermatocele, are benign fluid-filled sacs arising from the epidermis. Okay, so these are cysts that arise from the epididymis, and they are usually smooth and fluctuant nodules found above and separate from the testis. Very important, separate from the testis, and that will trans-illuminate. That you test for trans-illumination will be positive, and they are often multiple. Very often they occur in multiple. Very rarely they occur singly. And they are commonly seen in classically in the middle-aged men. They are common pathology. And the cysts rarely cause symptoms and no associated with malignancy. And generally, they do not need any treatment unless in rare cases when they become very large and painful or infected. Okay, these are some pictures to show you the epidermosis. This is the normal here, testis and epididymis. Here, testis is here. There's a separate cystic swelling just above the testis, and that is the epidermosis. This is the live pictures, two pictures here. This is the epididymis, and this is the epidermal cyst. You can see they are very closely adherent, but there is a gap between them. It is separated from the testis. Then the next condition is called inflammation of the epididymis, and this is known as epididymitis. And epididymitis or inflammation of the epididymis is present usually in one side, and unilateral, acute, and present as acute scrotal pain. And one of the most common cause of acute scrotal pain or unilateral pain on one side of the scrotum is epididymitis. They may be associated with swelling, erythema over the skin, and systemic symptoms such as fever. On examination, the epididymis is very tender and this pain can be relieved by elevation of the testis. Okay, as the slightly gently elevate the testis and the pain becomes less, and this is known as the French sign, Prehn, French sign. Epididymitis is commonly bacterial in origin and usually in sexually active young males. Okay, and these are the sexually related organisms, or they can be due to enteric organisms in older males. Most cases can be treated with oral antibiotics and analgesics. These are some pictures to show you epididymitis here. This is normal testis, epididymis. This is normal testis here, epididymis. Okay, and usually epididymitis is closely associated with the orchitis as well. Normally they occur together because they're very close to each other. So the infection tend to spread from the epididymis to the testis or the other way around. As a result, we call this epididymo-orchitis. And the last one is swelling, is inguinal hernia, which arises from testicular origin. And this inguinal hernia is due to the intestine passing from the abdomen into the scrotum through the external inguinal ring. And this This run passes through the scrotum alongside the spermatic cord into the scrotum. Okay, on examination, you cannot get a PERP. The upper limit cannot be ascertained because it is coming from the inside abdomen. And usually it will be the left cough impulse, then it will be the swelling becomes worse on standing and reduces on lying down. And this has a hernia, so it is very important in all such cases to assess for strangulation and obstruction. Okay, these are the pictures showing you the how the intestine from the abdomen travels down into the scrotum here. Okay, and here the picture to show you the inguinal scrotal swelling. Okay, it comes from the abdomen, so you cannot get above the scrotal swelling here. Okay, cannot get above. And of course, it's hernia, so you have to look out for cough impulse and reducibility. But you must bear in mind such hernias that reduce come into the scrotum may be obstructed or strangulated, as such cough impulse and reducibility may be not present.
Okay. The other important thing is now coming to the torsion, conditions arising from the testes. One is torsion. This is a very important condition. Testicular torsion is the twisting of the testes on the spermatic cord leading to ischemia. You can see here the veins here. There's also the spermatic artery, testicular artery that comes here along the spermatic cord. So when this twists, it causes this occlusion of this testicular artery, and that causes ischemia of the testes. Okay, it presents as a sudden onset, very usually is unilateral scrotal pain, very sudden unilateral severe scrotal pain associated with nausea and vomiting. Torsion predominantly affects pubescent boys, young boys, okay, before puberty, and may be associated with a bell clasper deformity, which is due to the high attachment of the tunica vaginalis. So the tunica vaginalis attaches very high up, and this allows the artery to twist along the axis. The affected testis is usually extremely tender, very, very important, very tender. It is raised, it's higher than the normal, and swollen, okay, with a loss of the cremasteric reflux. Okay, so this is very, very important. Extremely tender, presents as a scrotal swelling, okay, which is extremely tender, loss of cremasteric reflux, and also elevated. Okay, this is a feature of ultrasound. This is a normal ultrasound. This is a color Doppler. There's increase. There's a torsion. Decreases the vascularity. There's decreased vascularity here. You see, hypoechogenic here. Here also, there's not much of blood vessels here. So this is due to the ischemia of the testis due to torsion. And another important one is otitis, which is similar, which is related to the occurs together with the epididymis. Okay, it is inflammation of the testis, severe, usually due to virus. Sometimes can also be bacteria, especially sexually transmitted diseases, gonorrhea. It can cause pain, swelling, and tenderness in the testicles, and may be accompanied by fever, nausea, and vomiting. So it is quite similar to the presentation to torsion. Okay, the important thing is in otitis, the testis is grossly enlarged. Otitis is frequently linked to epididymitis, as I told you, because they are anatomically they are so related to each one another. And the treatment is usually pain relief and antibiotics. Okay, quite simple. All right, and this is the chart to show you the otitis. Is a bacterial cause, okay, or viral cause. And this is a normal testis. Here you see the testis is swollen. Otitis can be bacterial or viral, and I'm sure you all are very familiar with viral mumps, otitis. So the symptoms will be signs will be swelling, severe tender swelling associated with nausea and vomiting, moderate to severe pain, Okay, usually they are quite early, initial stages is very painful, and they have low-grade fever. And this is an ultrasound showing you the testis here, the epididymis and the testis here. There's increase. Doppler shows increase in vascularity due to inflammation, acute inflammation. There is increased vascularity. In torsion, the ultrasound shows decreased vascularity, the ischemic testis. Here is a hyperemic testis here. Now, the other thing is testicular tumors. While the vast majority of scrotal lumps are benign, with any testicular mass, it's always vital to assess for features of testicular cancer. And the most important thing is, classically, particular testicular tumors are described as painless lumps arising from the testes. In 5% of patients, there is associated testicular pain complicating the delay of diagnosis, which delays the diagnosis. If it is tender, you may think it is orchitis, and there's delay in diagnosis. Examination usually reveals a firm, irregular mass which does not transilluminate. It is non-tender and it does not transilluminate, that to differentiate from testicular cyst and hydrocele. Okay, testicular cancer is the most common malignancy in men aged 20 to 40 years. Okay, and the suspected tumor need an urgent ultrasound scan for diagnosis alongside tumor markers and for staging, which tumor markers to aid in this diagnosis, staging, and monitoring to the response to treatment. For lesions with a high index of suspicion, for suspicion for testicular cancer, a radical inguinal orchidectomy may have to be carried out, and that will give you the tissue diagnosis and confirmatory diagnosis of the type of the cancer that the patient may be having. The majority of these cancers are usually seminomas, and this responds well to chemotherapy. Okay, and the 5-year survival rate of these tumors are quite good. We shall cover more details in the next lecture. Okay, this is a simplified flow chart uh, illustrating the assessment of a patient with scrotal swelling or scrotal lump. Okay, this is a scrotal lump here. Can be unilateral or bilateral. If it is unilateral, you can get above it. Testis is separate or not separate. And then you see whether it's illumination. Okay, transilluminates. If it is transilluminates, then it's hydrocele. If it doesn't transilluminate, it's opaque. Then it can be tender or non-tender. If it is non-tender, you think of tumors. Okay, if it is tender, then you think of torsion, hematocele, and hematocele are usually due to trauma or epididymoorchitis. Okay, this is if it is unilateral, very important. Okay, now if it is unilateral, when you can get above it and it okay, and if you can get above it, it can be hydrocele. So if it transilluminate, it is epididymal cyst. If it is opaque, then and it is tender, it is epididymitis, tumor, or some form of TB epididym, which used to be a very common condition. Okay. Now, if it is cannot get above it, then it can be a hernia. Especially it cannot get above it and it is opaque, does not transilluminate, with a hernia. Can be a reducible, uh, reducible or non-reducible hernia. If it is transilluminate, is a hydrocele. So if it is a child, infant hydrocele, it is not non-reducible testis. Okay, sometimes. And if it is bilateral, usually sometimes the edema, or can be the condition itself is bilateral, 2 times the unilateral causes. So this is a simplified version. Number of things to look for, whether it's unilateral, bilateral, can get above, cannot get above, is it separate from the testis, or it is merged with the other structures? Is it tender? Is it painful? So these are all features that you must consider in the patient with testicular swelling. Okay, and finally, what are the key points? The scrotal lump is an abnormal mass or swelling in the scrotum. For the majority of scrotal lumps, an ultrasound scan of the scrotum is the best and the first line investigation. Causes of these lumps can be divided into extratesticular or testicular, which I've listed to you earlier. I've gone through in a short while. In all cases, you must ensure to assess for features of malignancy in all cases of scrotal swelling and send for urgent investigation if you suspect some form of malignancy is present. Because testicular malignancy has a very good prognosis, it occurs in young adults and this must be diagnosed as early as possible for cure. Thank you for joining me.